So namaste all, like once again I am here to compare the difference between Bacillinum and Tuberculinum in cases of adenoids, and that too especially in children. So friends, we always remember a sentence written by Dr. Kent that he has treated more than 1,000 cases, more than 100 cases only with tuberculinum. But we should understand that Dr. Kent was seeing almost thousands of cases over the period of years, and among that of adenoids, and among that he has got the cure of hundreds of cases. So now we are here to compare Bacillinum. It is commonly known as Bacillinum burnet, and Tuberculinum, which is known as Tuberculinum bovinum Kent, what we are using in our day-to-day practice. So Bacillinum basically it's a chilly remedy. So patient is chilly, but in Tuberculinum it's a hot. Then dryness will be there in coryza. So marked dryness is marked in Bacillinum. So it's leading to more of the symptoms of nasal obstruction. And in Tuberculinum there is exudation is more marked. So there will be free discharges or more discharges from the nose, and that's why patient may present to you with snuffles along with obstruction of the nose. But the part of obstruction of nose will have less dominant, but predominant will be discharges in Tuberculinum. Bacillinum often sweats very less, while Tuberculinum sweats a lot. Then Bacillinum patients will have cough with without expectoration or very less expectoration. But in Tuberculinum there is more expectoration and very they will expectorate if they have cough. Then Bacillinum cases will present with the normal physical makeup, or they are tend to have obesity, but it's opposite to Tuberculinum, which are lean, thin, emaciated, losing flesh while eating well. Then the difference comes about the from which material the nosode is prepared. So Bacillinum exact it is prepared uh, from the material which contains Tuberculinum bacilli along with other bacilli also, and Tuberculinum is prepared from the tubercle only, so abscess of tubercle. Then what does it mean? So Bacillinum we will require in our day-to-day practice more frequently than Tuberculinum, because mixture of or presence of multiple pathogens is there in today's era rather than in ancient era. Then the next difference is that about the potency and repetition. So we'll use the higher potencies always, more than 1 m, after considering these indications, anyone among Bacillinum or Tuberculinum. So in Bacillinum, if your case needs Bacillinum, then you have to repeat it very less. But in Tuberculinum you may require to repeat or increase the potency as per the requirement of your case. Then Bacillinum sensitivity to cold is not that much very marked, but in Tuberculinum cases now, see if they are taking the proper care to not to get ill from the cold wet weather or cold weather, or susceptible, they are very much susceptible cold. Instead of taking all precautions and cautions, they will often get the cold, cough and coryza repeatedly and frequently. So in terms of sensitivity, so Tuberculinum is more sensitive to changes in atmosphere, and that to cold atmosphere, than Bacillinum. So thank you to all. I have already committed in my last webinar session that I will compare between these two. If you answer the query which was asked by me for that, which was the rubric for deviated nasal septum from Phatak repertory. So many of you have rightly answered about that rubric from Phatak repertory. I am also glad that you are participating actively, It's my humble request to all of you to please share my channel and videos to the students and the doctors of homeopathy who really wants to learn. I am also waiting for your comments, your likes, because they motivate me to bring such more videos and prepare such more videos before you. I am also a learner of homeopathy and student of homeopathy. So once again, thank you all.